My name is Akaco Ekirapa. I'm the health team leader at the Foreign Commonwealth and Development Office in Nairobi. My topic is on scaling up capacity for women in leadership to influence and advance domestic resource mobilization for sexual reproductive health and rights programs in Kenya. My background is in health system strengthening and have worked across the East African region and also supporting health systems in global programs. Today, I'll focus on the triple burden that women experience, and this looks at the role of women as a caregiver, income earner, as well as the head of the household. Women also provide essential services for more than 5 billion people globally. And out of this, only 1 out of 4 women assume leadership roles in the health sector. My aim will be to identify key pathways for women to leverage their influence and build capacity with respect to creating awareness on gender integration, and also look at their roles on how to strengthen domestic resource mobilization platforms for SRHR programs in Kenya. So what is the problem? We know that women are underrepresented. We also know that donor resources are reducing significantly in low middle income countries, and the risk of all the investments we have made on women and girls is at risk of being diverted. We also know that women's insights and experiences are critical towards building accountability. And also, there's a burgeoning youth population in Kenya that also supports a high dependency ratio in the country. Interventions such as family planning and capacity of the health workforce are very effective in negating poor health outcomes. So I had a theory of change for my project where I looked at key components on policy, resources, and social cultural factors. And I also developed a theory that looked at the outcome to improve reproductive health services for Kenyans and to ultimately reduce maternal deaths. My SWOT analysis showed me that some of the strengths we have right now is that we have political willpower to improve reproductive health programs. We also know that Kenya is undergoing health reforms, the universal health coverage, 10 years after devolution. However, we have several threats and weaknesses, which also include gaps in gender leadership. We also know that we have inadequate capacity of our policymakers and decision makers. And also some threats are also the weak policy landscape, as well as the risk of reversing the gains we've made to progress towards SDG 2030 targets. Opportunities include leveraging on our existing health and financial resources, as well as leveraging on goodwill of females, both male and female leaders in health. Some key findings that I found, this was after I interviewed several stakeholders from both community level, people from the policy space, as well as research. And the key findings I found is that women leaders in healthcare are being empowered to become more visible, and there are opportunities for social inclusion and to become change agents at all levels. However, one of the challenges is that devolution is also a highly politicized issue. And because of that, we have seen significant reductions in the budget, including the latest family planning budget that was cut by half. We also need to know that communities need more sensitization beyond the current push for universal health coverage in Kenya. And for us to encourage ring fencing of health resources, this can only be done through strengthened public-private collaboration models. This looks at how my leadership journey has evolved as I look at my authentic leadership, inclusive leadership, strategic leadership, and also impactful leadership. My key learnings were that as an ambivert, I need to find ways in which I can use my strengths of both personalities with working with people, as well as also being able to influence more at the policy level. I have also taken up a role as an inclusive champion in my workplace, where I also champion for more marginalized populations, including people with disabilities. And strategic-wise, I also am a member of Task Force to support the government of Kenya to roll out universal health coverage in Kenya. The impact I've seen is actually being able to work on my imposter syndrome and start documenting more of my findings and my work, and also participating in more high-level impact panels. And so my parting shot would be that currently there's no strong empirical evidence that shows that women leaders are more effective in advocacy for health services. Secondly, my study findings showed that we need concerted efforts at all levels, from the community all the way up to the policymakers. And Kenya can only achieve universal health coverage by comprehensively addressing reproductive health and ultimately ending preventable child and maternal death. Thank you, and looking forward to your feedback.